Hi, my name is Ana Zúñiga and I'm going to talk about efficacy of the herpes zoster subunit vaccine in adults 70 years of age or older. Herpes zoster results from the reactivation of latent varicella zoster virus and typically manifests as a vesicular, painful dermatomal rash. The most common complication of herpes zoster, postherpetic neuralgia, manifests as chronic neuropathic pain that can greatly limit daily activities.
Herpes zoster, also known as shingles, is caused by the reactivation of the varicella zoster virus. It can happen at any age but is more common as we age. It causes a unilateral vesicular rash, which can be extremely painful and lead to complications. Nearly all Canadians have been infected with chickenpox and are at risk of developing shingles. The lifetime risk is estimated to be 30%. It occurs more often in older adults and immunocompromised patients, with 2/3 of cases occurring after the age of 50. Approximately 130,000 cases occur annually in Canada, resulting in 2,000 hospitalizations each year and 20 deaths. The most common complication of herpes zoster is post-herpetic neuralgia, a debilitating nerve pain that usually lasts longer than 3 months from the beginning of rash onset. Post-herpetic neuralgia is more severe if the shingles rash is severe and occurs later in life. It is very difficult to treat and can severely affect quality of life. Other complications include ophthalmic disease, which can lead to impaired vision or blindness if severe, neurological complications such as meningoencephalitis, Guillain-Barré syndrome, and myelitis, nerve palsies, secondary bacterial infection, pneumonia, and very rarely it can also cause death. 2 vaccines are currently available and will be discussed in the herpes zoster video part 2.
Applications in medicine. The overall incidence of herpes zoster is 2.0 to 4.6 cases per 1,000 person years, but increases with age to 10.0 to 12.8 per 1,000 person years among persons 80 years of age or older. Similarly, the incidence of postherpetic neuralgia also increases with age.
Patiently for just the right moment to cause shingles.
Vaccines are your best shot against shingles. What is shingles? It's a painful rash caused by the chickenpox virus. If you ever had chickenpox, the virus never actually went away. It stayed in your body as you got older, but it was dormant or asleep. Sometimes it stays that way, but other times the virus can suddenly wake up and cause shingles. In fact, 1 in 3 people in the United States will get shingles in their lifetime. Shingles usually starts on one side of the body or face. The skin can itch, tingle, hurt, or burn. A few days or weeks later, a painful, blistering rash will form in the same spot. The rash usually goes away in a few weeks, but some people develop a complication of shingles called post-herpetic neuralgia, or PHN, which can cause unbearable pain where they had the rash. Their skin can be so sensitive that even wearing clothes hurts, and this pain can go on for weeks, months, and in rare cases, years. Shingles vaccines are the only way to prevent shingles. Who needs to get vaccinated? The risk of shingles increases with age. So if you're age 50 or older, vaccination is recommended for you. The vaccines are safe. but you may feel sore where you got the shot. Some people also get a headache, muscle pain, fever, or nausea. These side effects usually go away after 2 to 3 days. The vaccines reduce the likelihood of getting shingles. And for those who do get shingles, vaccination may reduce the severity of the symptoms and the likelihood of painful complications like PHN. How do I get vaccinated? It's easy. You can usually get the shots at your doctor's office or local pharmacy, and vaccination against shingles is covered by many insurance plans. Okay, let's recap. Shingles is a painful, blistering rash that can lead to serious complications like post-herpetic neuralgia. So if you're age 50 or older, vaccination is recommended for you. You can get vaccinated at your doctor's office or pharmacy, and it's covered by many health insurance plans. Vaccination is your best shot at keeping you and your loved ones safe from certain infectious diseases. Talk to your doctor about getting vaccinated, and visit vaccines.gov and healthfinder.gov to learn more.
Pros and cons. Antiviral therapy can reduce the duration of herpes zoster rash, but has not been shown to decrease the incidence of post-herpetic neuralgia. Vaccination is therefore an attractive option to reduce the disease burden due to herpes zoster and its complications in older adults. Currently, a live attenuated herpes zoster vaccine is approved for use in adults 50 years older and is recommended for adults of 60 years of age or older.
Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care from Raleigh. And in this episode, I would like to explain the shingles vaccine, because shingles can cause lots of eye problems when there's an outbreak around the eye. This includes inflammation, pain, or even scarring or clouding of the cornea, which can interfere with vision. If you look back to A State of Sight, episode number 73, I go into more details about the shingles virus and the problems that it can cause around the eye. But today I would like to go into more detail about the vaccine. You may have seen commercials recently about the shingles vaccine explaining that if you have had chickenpox, then the virus already lives inside of you. Now this is a little bit scary, and of course it's marketing, but it's completely true. This virus, after you've had chickenpox, which is the varicella zoster virus, or also called herpes zoster virus, can live in the sensory nerves and then come out in a reactivation along one of the nerves. With this outbreak, if it goes to the nerve we call the V1 nerve, or the V1 distribution, it can be running from up in the head to the forehead to the eye and then down the side of the nose. When we see this, that's when we are concerned about eye problems, and the vaccine is very effective in preventing outbreaks of shingles. Now, it's not 100% effective. Maybe between the studies it shows it's maybe between 50 and 70% effective, and we're not sure about the long-term effectiveness since it's available since 2006. After 5 years, it appears that maybe the effectiveness decreases. At this time, the vaccine is approved for people ages 50 and older. That's when we tend to see shingles, although we can see it in younger people, even into the 20s or even younger, but it's more common with older people. And now we wonder, since there is a chickenpox vaccine that children are receiving, that in their future, hopefully they will not have a chance to have shingles since they have never had chickenpox. With that, they are not exposed to the virus, so it doesn't have a chance to recur in them. But then also we wonder if, since we are not naturally being exposed to more virus as these children start growing up, if we don't get natural boosters to our immunity, and we may have more risk of seeing more shingles as time goes by. So if you have any questions about this vaccine or shingles virus and how it may affect the eye, please post. We'll be happy to answer them, and hopefully see you again soon next time on A State of Sight.
Issue applied in Ecuador. A trial involving adults 50 years of age or older showed that the herpes zoster subunit vaccine containing recombinant varicella zoster virus glycoprotein E and the AS01B adjuvant system was associated with a risk of herpes zoster that was 97.2% lower than the associated with placebo. A second trial was performed concurrently at the same sites and examined the safety and efficacy of the herpes zoster subunit vaccine in adults 70 years of age or older.
Shingles is a skin rash caused by varicella zoster virus, the same virus that causes chickenpox. It is a painful skin rash, usually with vesicles, and occurs in a cluster or band localized to a small area of the body. Shingles occurs when the virus that causes chickenpox becomes reactivated. After one recovers from chickenpox, the causative virus becomes dormant in the nerve roots. In some people, it remains dormant forever, while in others, the virus gets activated if the person becomes stressed or has a weaker immune system. In few cases, certain immunosuppressive drugs may also cause activation of the virus. The initial symptoms one may feel are itching, tingling, or pain in the area. That's where the rash will appear after a few days. The rash will turn into a cluster of vesicles. Then these vesicles break into small sores which will dry and form crusts. These crusts will fall off by themselves in 2 to 3 weeks. Other symptoms that you may experience include abdominal pain, fever and chills, general ill feeling, genital sores, headache, joint pain, and swollen lymph nodes. During the shingles attack, especially when skin blisters are present, the virus can be transmitted to people who have never had a varicella virus. In general, these are mainly children. Varicella infections can be harmful to newborn babies. Therefore, people with active shingles need to avoid contact with newborn babies. In elderly, shingles can occur when they come in contact with children who have chickenpox infection. Shingles usually gets healed by itself without any treatment. Treatment is recommended when shingles is present on the face or when one has low immunity. Treatment of shingles includes prescription of an antiviral, anti-inflammatory, and antihistamine medicines. Antiviral drugs such as acyclovir may be prescribed to fight against the virus. It is best to start taking antiviral drugs before the vesicles appear. Anti-inflammatory medicines such as prednisone are given to decrease swelling and pain. Also, painkillers and cool wet compresses can help reduce pain. To speed up drying of the vesicles, daily application of a zinc-containing ointment can be used. Shingles can be prevented by avoiding contact with people having shingles or chickenpox and getting vaccinated with the herpes zoster vaccine. For any further information or advice, you can best consult your family doctor.
Conclusions. In the trial, herpes zoster subunit vaccine was found to reduce the risks of herpes zoster and postherpetic neuralgia among adults 70 years of age or older.
New research shows 1 out of every 3 people in the United States will develop shingles in their lifetime. That risk increases as you get older. Dr. Brandy Patterson discusses a new vaccine in this week's segment of Straight Talk MD.
Hi, I'm Dr. Brandy P. with Straight Talk MD. Now, my mom used to bring me to the doctor's office for vaccinations, which I didn't mind too much because I knew at the end I would get a lollipop. But after a certain age, we assume we're all done with the vaccinations and the lollipops that go with it. But there is one vaccine that is a must for older adults, the shingles vaccine. If you're not familiar with it, shingles is a virus that causes a painful, blistering rash. The rash typically resolves in a couple of weeks, but in some people, the pain persists due to lasting nerve damage, and this can really impact quality of life. Shingles is caused by the same virus that causes chickenpox. So, if you had chickenpox as a child, the virus can reactivate later in life and lead to a shingles outbreak. You're most at risk after the age of 50 and when medical conditions or medications cause your immune function to decline. The only way to truly protect yourself from this virus is to get vaccinated. Recently, a new shingles vaccine was introduced called the Shingrix vaccine. It replaces an older version called Zoster. Studies have shown that the new vaccine is much more effective because it improves the immune response for a longer period of time. The Centers for Disease Control and Prevention recommend that you get the new shingles vaccine if you are a healthy adult, age 50 years or older. Even if you previously received the original Zoster vaccine, you can still get the new vaccine. Just be sure to wait at least 2 months between vaccinations. There are 2 doses of the vaccine, so you will need to get 2 shots. They are given 2 to 6 months apart. These 2 doses will last for life. If you are immunocompromised, currently have shingles, or you are allergic to any components of the vaccine, you should not get the vaccine. If you are over age 50, be sure to talk to your doctor about the shingles vaccine. And as always, thank you so much for watching this segment of Straight Talk MD.